At the beginning of the pandemic, nobody really knew what we were in for.
A lot of us were nervous, myself included, as to what to expect, the impact on our primary roles in the hospital, our patients.
It's like that layer of COVID fear versus the old flu that we knew about.
My name is Jaclyn Robinson. I was one of the first patients admitted to VGH with COVID. It was back in March 2020 when I started feeling sick, and the whole world was starting to feel very different.
When Jackie started getting ill, I felt fairly aware of how serious the disease was.
I think in the beginning, I just didn't have a clear understanding of how big it was really going to get. I knew it was serious, and I knew people were losing their lives.
When the threat is something you can't see, that raises the stakes quite a bit.
Day 8 of my illness, I feel like I have access to about 20% of my lungs. I can't seem to breathe. And my husband looked at me and he said, "You can't even get through a sentence. You're so short of breath."
I started panicking, truly. I was like, "You're going to the hospital right now."
And I said, "I'll meet you at the hospital." And little did I know I wouldn't see him for over 2 weeks.
ER, shortness of breath, requested code 2.
I arrived at Vancouver General Hospital emergency, and I just remember being pushed into this isolation room and the door shuts. Before I knew it, there was about 20 faces all outside this window staring at me with very concerned eyes.
I remember her being really scared. You could see it on her face.
I was starting to realize how sick I was. Like, I was absolutely terrified.
Jaclyn was unique in that she was also a nurse. It affected her, so it could affect any of us.
I started with oxygen on my face, and that wasn't giving me enough. Then I started with pressurized oxygen, and it still wasn't enough.
In Jackie's case, it became clear that she had to be put on life support.
I was in total shock. I didn't want to be put in a coma. I was so uncertain about what that meant.
That was pretty much the scariest moment of my life, for sure.
Part of our goal anytime we put someone on the ventilator is to not just give the body a chance to heal, but also to prevent injury.
Whenever you're ventilated, your body stops using your respiratory muscles. And then the longer you're on a ventilator, the weaker you're going to get, and the more you're going to have to work to get off of it.
Being at home when your loved one's in the hospital is difficult, but we're able to, talk about the details, and hopefully our team was able to offer him some peace of mind.
Dr. V was really great about, just meeting me where I was at. So that was, yeah.
It was 7 days later, I woke up. I didn't know where I was. I didn't know what had happened to me. And I have 2 huge chest tubes hanging out of my lungs.
When we were able to remove Jaclyn's ventilator, it felt hopeful that people can make it through, because especially in the beginning, you didn't really hear about anybody recovering.
With COVID, it's really exposed how respiratory therapists are so important. Rami in particular, she became like a sister in that scary time.
And here she is in the hospital, like so scared, no one around her, no one can visit her. So I want her to feel like she has a friend.
The only thing I wanted was to see my family. I just needed to see something orientating. Sherry tracked down my phone and she's like, "Okay, we're ready, let's do this." All of a sudden I see all 3 of my girls and Kirk on this little screen. It was just so powerful to see them and for them to see that I was alive.
Being able to have her reconnect with her husband and her daughters and see them on the screen and their faces light up, it is a very rewarding part of taking care of patients when you're able to see the joy of the family members and kind of that fear get wiped away.
I've been a nurse for 20 years. Until you're a patient receiving care, you don't understand what matters. What really matters is the moments of human connection. I'll always remember Dr. View came into ICU. He's like, I just need to see that you were alive and getting better. He said, that's all I needed.
I think that we're exceptionally lucky to have caring medical staff like we do at VGH.
They have come together and seen each other through the hardest, scariest time that you can imagine in healthcare. I feel overall quite grateful of where I'm at today. It's been 18 months since I've had COVID. I sit here sharing my story, hoping that people can see this is a facility worth giving to. It's a facility that supports their staff and that cares about their patients and families.
To the staff at VGH, I only have a big thank you. That is it. The biggest thank you ever.
I want to tell every single staff member, you are doing the hard work and you're making a difference. You're the reason why I'm here today.